Well, hello, my name is Bob Bingu. I'm the Vice President for Medical Education. It's my pleasure to have Dr. Bud Higgins join us today. Thank you, Bud, for joining us and talking to us about retirement.
My pleasure.
So my first question is, or actually request, is just to share with us, Bud, a little bit of your background.
Medical background, I'm assuming. Yeah. So I fell in love with emergency medicine when I was in training. And back then there was no specialty, there were no training programs. So after a few years in internal medicine, I gravitated toward the specialty. And then I had the privilege of having lots of opportunity here. So I became chief of the department, helped establish the residency, then went into administration for a while, went back to academic medicine as a research director. And then when I turned 70, said, probably it's time for me to do something different. So it was a wonderful, wonderful career here. I value it to this day. So that's my experience.
Great, thanks. So as physicians think about retiring, what kind of broad areas do you think they should be thinking about?
I've given that some thought, knowing that you and I would be discussing this. And it comes down to a simple thing for me. We as physicians, whether we know it or not, have an exceptionally rich and satisfying life professionally. I'm not sure we recognize it while we're having that life, but I think I've determined that to leave that life behind totally as a clean cut is probably not best for most of us. And I've valued being able to take my experience that I still have and will always have, and by the way, you only get experience with time, making mistakes and so forth, that I can still use that experience in some way. So I guess my one suggestion as you start to plan for retirement is I'd be careful about saying let's leave it all behind without some thought about that.
Okay. So how did you in particular go about planning for retirement?
Yeah, so as I said, I went into administration for a while, and I realized that was not a long-term possibility for me. It was great work, but not satisfying emotionally. So I went back into academic medicine, but then realizing I would be moving in this direction, I started making concrete steps, so going from full-time to half-time, going from an administrative research director position back into academic medicine. And in the meantime, I started providing occasional care for very small, rural, critical access hospitals to get out of the academic realm, to get into that environment. And I found it very, very satisfying. So I knew that if I left academic medicine, I had something else that really was meaningful in a different way. So that's kind of how I made the transition. That was a 3 or 4 year process for me, going from I think I want to retire from Maine Med to when I did retire. And I'm glad I took that much time.
So not a quick process?
Never, no.
Okay. And did you come across any particularly useful resources or things that helped you in that 3 or 4 year process?
No, but my experience here had allowed me to witness physician lives in many different ways, from pure clinical practice to more administrative academic practices. So I think without asking those people about it, I witnessed what they did. I witnessed what happened when they left. I ran into colleagues who had retired. So without really getting at a resource, I think that I sublimated that into my thinking. And when I met retired friends who were most satisfied, they were satisfied with their non-physician life, but they also had some connection to something that brought them back to what had been meaningful for their whole career.
So would you suggest that physicians thinking about retirement speak to several retired physicians?
I think it's always helpful to do that. It depends on where you are emotionally. I mean, if your practice or whatnot has burned you out, made you cynical, that's one place. The folks that I've been around aren't in that position. They're in a position of making a decision to move on to something else in their lives not leaving behind something, but moving to something greater. So I would recommend focusing on those folks that seem to have done something that gives them meaning each day. And sometimes that is voluntary work at a clinic or education or international medicine or something that allows, for instance, I was very influential in my little island of Peaks Island of bringing the health center there to a very solid footing by connecting with Maine Med. And that was a really meaningful experience for me, and still is. So anything you can do, I think, that will help you use that experience that you've just collected over 30 or 40 or 50 years to continue to add rich value to your life.
Okay. And how are you staying currently engaged professionally? Are you still working at the rural critical
Yes,
access?
so I go to Holton now. I was at Machias, Holton Regional, and I am it with the hospitalist.
Okay.
Managing that entire community, which is really pretty profound. I do that once a month. I'm on faculty. I do 3 to 4 national presentations a year, so that makes me really keep up on medical literature, which I love. I am involved with Peaks Island Health Center, as I told you, and watching that resource help our community be healthy has been really satisfying. And by the way, I've become sort of the person people on the island call when they want advice. So I'll go make house calls to help them navigate through whatever issue they have and direct them. I find that very satisfying. So all of those things, once again, play on my experience as a physician and allow me to continue to touch that part of my life.
Yep. Are you involved with the residency still, or?
I'm not.
At this point.
Other than, very satisfyingly, many of our emergency medicine graduates I run into.
Okay.
Because they're doing rural medicine or whatever, so that's been very, very
Yeah.
helpful.
Great. My last question is, any other final words of advice for physicians thinking about retiring?
No, I think it was really hard for me emotionally to get to the point where I thought I could give it up. And if I were still there in the emergency department, in emergency, I would be having a ball. So that was a big step for me, and I know it will be for anybody going. So don't minimize it. Take your time. Don't rush it. And think about all that experience you still have to share in some way. So that would be my final thoughts on that.
Great. Great words of wisdom. Thank you, Bud.
Thank you, Bob.
Okay.